My name is Dr. Thaddeus Stappenbeck. I'm the chair of the Department of Inflammation and Immunity in the Lerner Research Institute at the Cleveland Clinic. My research interests are in the areas of wound repair in the intestine. Clinically, I'm interested in how this research applies to inflammatory bowel disease. The subject of my paper is creating an animal model for penetrating fibrosis that occurs as a complication in Crohn's disease, a major form of inflammatory bowel disease. We first defined a transcriptional signature of mesenteric fibrosis in CD subjects. Fibrosis in Crohn's disease extends from the innermost layers of the intestine, the mucosa, to outside of the intestine into the surrounding mesenteric fat. We used histologic sections of paraffin-embedded, formalin-fixed material from surgical resections. Importantly, we used each patient as its own control, comparing mesenteric fat in areas that had extensive fibrosis versus those areas without fibrosis. We compared global transcriptional signatures between these two areas and found a transcriptional signature that defined the mesenteric fibrosis in this region that included expected genes such as type 1 collagen. A challenge to functionally test genes that potentially play a role in penetrating fibrosis is that there are limited mouse models that have this feature. Our goal was to create such a model in the mouse colon. Our research used a biopsy injury system in mice to create focal injuries along the length of the distal colon. Doing this repetitively every 2 weeks, minimally 3, but as many as 4 times over the course of 2 months, we observed evidence of penetrating fibrosis into the surrounding fat, as shown grossly by fat that is stuck to the outer wall of the colon, and confirmed by histology to show evidence of fibrosis. We collaborated with an excellent team in the Mallinckrodt Radiology Institute at Washington University to image this fibrosis in live mice using PET probes targeted to collagen 1. We then compared the transcriptional signatures of the penetrating fibrosis within the mouse model to what is seen in humans. With colleagues at Berger Ingelheim, we created a 24-gene set list that was linked to inflammatory fibroblasts, which are a hallmark of penetrating fibrosis. We probed multiple existing biopsy-based transcriptomes from Crohn's patients and found this 24-gene set was predictive of response to TNF-alpha therapy. This type of signature could impact predictions of how types of patients will move forward, whether they develop severe disease or not, and potentially how they will respond to specific therapies. The conclusions of this study are that we have created a mouse model of intestinal penetrating fibrosis using repeated colonic biopsies in mice. This resulted in penetrating fibrosis, which recapitulates key cellular and molecular features of Crohn's disease penetrating fibrosis. This could be imaged in live mice. This model should be useful for pathogenesis research, as well as a model to test candidate therapeutics for penetrating fibrosis. Lastly, the 24-gene set is useful as a predictor for response to therapy. Thank you.